In the dimly lit bathroom of his apartment, Marcus, the Titan Novak, stood in front of the mirror. He was a competitive bodybuilder, known for his chiseled physique and commanding stage presence. But Marcus wasn't satisfied. He never was, he never had been. Since he was a kid, he tried to be the best. Now, nothing has changed. He would be willing to put it all on the line to be the best. The regional competition was 2 months away, and he was determined to win at any cost. This time, the cost would be more than he'd anticipate. Tonight, clenched in his hand, was a vial of testosterone enanthate. Testosterone enanthate is a long-acting synthetic form of testosterone, a hormone crucial for muscle growth, strength, and recovery. Bodybuilders often inject it to enhance their performance and achieve rapid muscle hypertrophy. While it's prescribed medically for conditions like low testosterone levels, Marcus wasn't using it under a doctor's supervision. Instead, he was what they call stacking, combining it with trenbolone acetate, another potent anabolic steroid known for its ability to dramatically increase muscle mass and strengthen himself while reducing fat. Trenbolone acetate, however, comes with a heavy risk profile. It can cause severe cardiovascular strain, liver toxicity, and hormone imbalance. Despite the warnings, Marcus saw these substances as his ticket to glory. Tonight, Marcus decided to increase his dose significantly. The recommended medical dose for testosterone enanthate is around 50 to 100 mgs per week for hormone replacement therapy, also known as HRT, but Marcus was nearly injecting 1,000 milligrams. He rationalized it as necessary for the gains. Little did he know, his body was nearly at its breaking point. The first warning signs that Marcus had experienced was 2 weeks after increasing his dose. Marcus began to notice the changes. His heart would pound during his workouts, even when lifting light weights. This wasn't the usual post-set adrenaline rush. It felt like his heart was trying to break free from his chest. At night, he struggled to sleep, sweating through his sheets despite the winter chill. These were early signs of cardiac hypertrophy, the thickening of the heart's walls. Anabolic steroids can accelerate this condition, leading to reduced heart efficiency and an increased risk of arrhythmias. Marcus also started experiencing gynecomastia, which is a condition where male breast tissue enlarges due to the imbalance between estrogen and testosterone. Anabolic steroids can lead to the excessive conversion of testosterone into estrogen via the enzyme aromatase. For Marcus, this was a humiliating side effect, one he tried to cover under oversized hoodies. Yet, he still ignored these symptoms. His muscles were growing, and his followers on social media were taking notice. Every post he made generated thousands of likes and comments praising his dedication. The validation was intoxicating. The collapse. It was during a grueling leg day at the gym that Marcus's body gave out. He was midway through a set of squats when he felt an intense pressure in his chest, as if an invisible hand was squeezing his heart. He dropped the barbell and collapsed to the floor, grasping for air. Paramedics arrived on the scene within minutes, but Marcus was slipping in and out of consciousness. At the hospital, doctors quickly diagnosed him with acute myocardial infarction, also known as a heart attack. His blood work was awful, revealed sky-high levels of LDL, the bad cholesterol, and dangerously low HDL cholesterol, which is the good cholesterol, both which are common side effects of anabolic steroid use. The steroids had caused a buildup of plaque in his coronary arteries, restricting blood flow to his heart. Worse still, his liver enzymes were elevated, indicating hepatotoxicity, liver damage. Trenbolone acetate in particular is known for its hepatotoxic effects, especially when used in high doses. His kidneys weren't faring much better. He was on the verge of acute kidney injury. due to the dehydration levels and high levels of creatine, a byproduct of muscle metabolism. Marcus's recovery. Marcus ended up surviving the heart attack, but his life had been changed forever. His cardiologist explained that his heart had suffered permanent damage, and now he was left with left ventricular dysfunction. This means that his heart couldn't pump blood as efficiently as before. He would be on medication for the rest of his life, including beta blockers and statins to manage his cholesterol and to reduce the strain on his heart. The gynecomastia he suffered with required surgery to correct, leaving him with scars that would never fade. His kidneys, while not failing, were severely impaired, requiring a strict diet and regular monitoring. Most devastatingly for Marcus, he had to abandon bodybuilding. His body couldn't withstand the physical demands of the sport anymore. The trophies on his shelf now felt like a mockery, reminders of a path that nearly cost him his life. The takeaway of Marcus's story. Marcus's story is a cautionary tale for anyone considering anabolic steroids. While they can deliver rapid results, the risks far outweigh the benefits. Anabolic steroids disrupt the body's natural hormone balance, leading to severe and often irreversible health consequences. Testosterone enanthate and trenbolone acetate are powerful substances, but they are not designed for casual use. Without medical supervision, their misuses can lead to heart attacks, liver damage, kidney failure, and even death. For those seeking to improve their physiques, there are healthier, safer alternatives. Proper nutrition, consistency, and proper training and patience can achieve lasting results without compromising your health. Marcus had to learn this the hard way. Don't let his mistakes become your reality. He often says now during his talks at schools and gyms, the stage isn't worth your life. It never will.